Phase 2, the grand finale. Once the semen is gathered and ready, the expulsion phase takes the spotlight. The external sphincter that was holding things shut now relaxes. Almost simultaneously, your perineal muscles, located at the base of the pelvis, contract rhythmically and forcefully, propelling the semen along the urethra and out of the body. It's pure biology and physics working in tandem, muscle contractions, nerve signals, and fluid dynamics all integrated seamlessly. This elegance underscores the importance of respecting our bodies through healthy living habits, ensuring we can continue enjoying a sense of vitality and independence even as we age. Does ejaculating less often affect health? What if it doesn't happen regularly? After dissecting the how and the why of prostate function and ejaculation, a question often arises. What if I don't ejaculate that frequently? Could that be harmful? While there aren't definitive studies stating that infrequent ejaculation directly causes serious diseases, there is a nuance here. If you already have prostate concerns, such as inflammation or congestion, ejaculating too infrequently could potentially exacerbate symptoms. Think of a river that doesn't flow often. Water might stagnate and create problems. Furthermore, one notable area of research centers on chronic bacterial prostatitis. A 1999 study revealed that men with chronic prostatitis experienced a significant improvement in symptoms when they increased the frequency of ejaculation through either intercourse or masturbation. This finding hints that regular sexual activity can be part of a proactive plan to maintain prostate health and overall well-being. When we talk about living well, extending our vitality, and maintaining our independence in later life, every piece of the puzzle, mental sharpness, physical exercise, and balanced nutrition, plays a meaningful role. Additional benefits of ejaculation: sleep, stress relief, and more. Ejaculation isn't just linked to prostate health. Surprising as it may sound, regular sexual activity, including masturbation, can positively influence other aspects of your well-being. One particularly interesting finding relates to improved sleep. Research from 2023 suggests that both sexual activity and ejaculation shortly before bedtime can make it easier to drift off and enhance sleep quality overall. This holds true for men and women alike. Why might this be? The release of certain hormones following orgasm can help the body relax more thoroughly, paving the way for a deep, restful slumber. Good sleep, as many of us know, is a cornerstone of feeling happy, energetic, and cognitively clear. So, while exercise, nutrition, and mental engagement remain key pillars of health, don't overlook how a regular, fulfilling sex life can also add to your overall quality of life. Ejaculation and prostate cancer risk. Frequency matters. But why? Here's a topic that might have already crossed your mind: the link between ejaculation frequency and prostate cancer risk. The encouraging news is that several large-scale epidemiological studies point toward a protective effect. One famous study followed over 30,000 men for nearly 2 decades. The results? Men who reported ejaculating 21 times or more per month had a noticeably lower risk of developing prostate cancer than those who ejaculated between 4 and 7 times per month. And it didn't matter much whether these ejaculations were through intercourse or masturbation. The key element was frequency. This pattern has been backed by other studies, including more recent research from 2017 and 2018. The protective effect seems particularly relevant for men in their 30s and 40s, a critical window for laying the foundation of long-term health. Combine that with other healthy habits: balanced eating, staying active, and keeping your mind bright. And you have a recipe that may support greater independence and happiness as you age. That said, these studies do have limitations. Many rely on participants recalling past habits, which can lead to inaccuracies. Still, the trend is clear enough to suggest that consistent sexual activity can be beneficial for prostate health. Possible protective mechanisms. Why does ejaculation help? Scientists have some intriguing theories about why frequent ejaculation may help lower prostate cancer risk. The most common explanation is the house cleaning hypothesis. Regularly expelling semen may help flush out carcinogens or toxins that could accumulate in the prostate and seminal vesicles. Less contact time with harmful agents means fewer chances for cells to undergo cancerous changes. Hormonal regulation may be another factor. The balance of testosterone, dihydrotestosterone, DHT, and even estrogen can influence prostate cell growth. Ejaculating regularly might help keep these hormones in equilibrium, reducing the likelihood of cellular overgrowth. Moreover, regular sexual activity could give your immune system a boost, making it more adept at spotting and eliminating abnormal cells. Improved blood flow in the pelvic region, spurred by those muscle contractions, may also lower local inflammation and oxidative stress, both of which can contribute to tumor formation and aging. Surgical interventions and their impact on ejaculation when surgery becomes necessary. Let's address a more delicate topic: the potential consequences of prostate surgery on ejaculation. Procedures to remove overgrown prostate tissue, commonly done for benign prostatic hyperplasia, BPH, or the entire prostate gland, as in cases of cancer, can lead to significant changes in sexual function. Surgery for BPH. Often, only excess tissue is removed, preserving the outer capsule. A frequent outcome is retrograde ejaculation, where the semen travels backward into the bladder instead of outward through the urethra. Though not harmful to overall health, it can alter the experience of orgasm and affect how one perceives sexual satisfaction. Radical prostatectomy for cancer. Here, the prostate and seminal vesicles are entirely removed. The urethra is then reconnected directly to the bladder, leaving no structures to produce the bulk of semen. Consequently, ejaculation as you once knew it ceases. There's also a risk of urinary incontinence and erectile dysfunction because important nerves run very close to the prostate. The good news is that surgical techniques, particularly robotic or minimally invasive methods, have improved significantly, enhancing the prospects of preserving erectile function and urinary control. Still, it's vital to understand these potential trade-offs and prepare mentally, physically, and emotionally. Healthy lifestyle habits can aid in recovery, offering a smoother transition to life after surgery. Thank you for joining me on this deep dive into men's health and longevity. If you found any part of this helpful, please give it a like and share it with someone who might benefit. And if you haven't subscribed yet, now's the perfect time. Stay curious, stay active, and remember, taking care of your body is the foundation for a vibrant, fulfilling life at every stage.